Hello everybody, I'm Dr. Prasanna AV, consultant neuro and spine surgeon. Today I'm going to talk about stroke and its surgical management. I will explain in very simple terms what is stroke, when to approach your doctor and when to get the suitable treatment. Stroke usually is of two types. One, when there is excessive bleeding inside the brain, or the second, when there is a lack of blood supply to the brain. Regardless of the nature of the stroke, patients tend to present in a similar way. Most of the complaints are sudden onset headache, sudden onset severe vomiting, usually paralysis or weakness of one side of the body. Sometimes even the patient can become suddenly unconscious, sudden onset giddiness. So various symptoms are there. So whenever such symptoms are there, usually these happen in patients with already long-standing history of hypertension. Usually happens in an age group of above 50. Though I've been practicing since last 20 years and I have seen a very high increasing trend in younger population. So any of these symptoms, we should have a very high index of suspicion. Basic one, CT scan should be done. The doctor should be consulted because most of the strokes have what is called a golden hour. If you manage it, if you diagnose it within the first hour, the treatments which are available can really save the patient, can minimize the morbidity and mortality. So most of these strokes can be managed medically, can be managed conservatively. However, when surgical indication is there, particularly when a big clot is there which is causing a lot of pressure in the brain, or an aneurysm which is a balloon-like outpoaching of any of the blood vessels in the brain that has bled, we require to clip it, we require to close that bleeding point. Or when there is swelling in the brain due to lack of blood supply, we require what is called a decompression craniotomy. However, the main point I want to stress is that these symptoms, stroke-related symptoms, should not be neglected, should not be ignored. The moment you feel there is something wrong, it is always better to consult a doctor. Get a basic scan done. Most of the times, a basic simple CT scan would be good enough to show if there is a stroke. But small strokes, MRI of the brain is the method of choice. Whenever we have time, it's better to get an MRI brain. But if the patient is critical or serious or something, a plain CT scan also will give us the necessary information. So the stroke is something, as I've told you, has to be viewed with very high index of suspicion because the management in the first few hours following the stroke is extremely critical and often it decides the final outcome. Thank you.